It's a growing complaint across the country. Doctors and nurses concerned profits are put ahead of patients as more private equity firms take over healthcare groups.
We've been covering how private equity firms have been snatching up healthcare services and groups across the country, leading to rising healthcare costs and, if you can believe it, an even more broken system than what we already had. The latest development in this ongoing trend is that private equity firms are now buying up anesthesia practices and sharply raising prices to turn a profit. In one jarring example, in less than a year, the multi-billion-dollar private equity firm known as Welsh, Carson, Anderson, and Stowe created Colorado's biggest anesthesiology practice. I'll have more on that in a moment, but first, here's a reminder of how private investments in healthcare have impacted patients in need of care.
Today, it's estimated over 40% of the nation's emergency departments are overseen by for-profit staffing companies, all of them owned by private equity. These Wall Street firms look for a return on their investments on a shorter timeline, and academic researchers tell us the largest profits are often in the ER.
How does that affect patient safety?
What I was concerned with is having an adequate time to do the job properly. As our volumes grew and the popularity of our ER grew and our responsibilities grew, it became clear to us that my physicians were being asked to be in 3 places at once.
Bravant says that wasn't the only problem. He says doctors and nurses were expected to improve metrics by admitting more patients without adequate exam time or bed space.
Wow, isn't it just wonderful that our government is turning a blind eye to profit-driven speculators who treat patients experiencing medical emergencies like garbage? These patients represent dollar signs. The more the better. Get them in, push them out. Who cares about the quality of care? Look, now back to the private equity firm Welsh, Carson, Anderson, and Stowe, and the impact they've had on anesthesia practices. The firm is quickly monopolizing the market in Colorado specifically through a company the financiers created called US Anesthesia Partners. In 2015, the company bought the largest anesthesiology group in the Denver region, but they weren't finished. Then they bought the next largest. Then it bought a few more. The company employed 330 anesthesiologists in Colorado at one point, according to its website, making it the state's largest practice by far. It obtained contracts at 10 of the region's 15 largest hospitals, and that's according to the hospitals. In fact, since its founding back in 2012, USAP has built a staff of more than 4,500 clinicians across 9 states. Antitrust laws would have one believe that federal regulators should, maybe do something about this. And to be fair, the Federal Trade Commission did inquire about the acquisitions, but that's about it. The FTC ultimately decided to do nothing, and this has been the rule, not the exception.
Dr. Robert McNamara is the chair of emergency medicine at Temple University. He's also the chief medical officer of a group representing about 8,000 emergency doctors nationwide.
Do you think private equity firms should be in the business of medicine?
Certainly not in emergency medicine. You're having people that are seeking to make a significant profit off of healthcare.
There are laws on the books to prevent the corporate practice of medicine. Are they not being enforced?
No, they're not being enforced.
McNamara says state attorneys general rarely prosecute these types of cases, and doctors often don't speak up for fear of losing their jobs.
And these are billion-dollar companies that you're fighting. You're fighting Wall Street.
And I mean, Wall Street reigns supreme in the US, doesn't it? Now, after Welsh, Carson, Anderson, and Stowe acquired the bulk of anesthesiology practices in Colorado and managed to dominate that market, the firm proceeded to do what it intended to do all along: raise prices. The company raised prices for its services, won by nearly 30% in its first year in Colorado, and continued raising them for several years, according to interviews and confidential company documents obtained by the Washington Post. The price hikes boosted patient bills and pushed up insurance rates, former company physicians and managers said. Eventually, some of the company's own doctors became disillusioned, physicians said, with 1 in 3 leaving the company over a 3-year period. This is it. This is what they do. Private equity firms like Welsh, Carson have become critical players in healthcare economics, with private equity funds acquiring hundreds of physician practices across America, and according to multiple academic studies, raising prices while returning billions of dollars to their investors. A 2022 study published in JAMA Internal Medicine based on 6 years of data found that when anesthesia companies backed by private equity investors took over at a hospital outpatient or surgery center, they raised prices by an average of 26%, more than facilities served by independent anesthesia practices. Since its founding in 2012, it has issued more than $1.3 billion in dividends to its shareholders. And I just want to pause for a second and address the impact this has on insurance premiums. Now, there is a lot of bad behavior going on when it comes to, various hospitals, various doctors, in this case, companies backed by private equity firms, overcharging private insurers for various services. Do you think the private insurance companies just eat it? Or do you think that they, pass those costs on to the people who buy insurance and need insurance? So we all pay more for insurance due to the greed of these private equity firms. And that's on top of patients, specific patients, having to pay more for services because these private equity firms are looking to increase their profits. I mean, how else are they gonna provide those sweet, sweet dividends to their investors? Now, the company claims that they have significant competition and that negative information reporters are getting from people are actually just disgruntled former physicians. Right. Now let's look at the facts, okay? So company officials did not share annual price increases on contracts, but said the companies, but they did say that the company's negotiated rates with insurers in Colorado rose at a rate of 3.7% annually from 2014 to 2019. That's a total increase of 20% over the 5-year period, meaning USAP's prices rose twice as fast as median prices measured by a national survey by the American Society of Anesthesiologists. In fact, the company raised prices so much that the insurer United Health dropped them. In fact, the insurer said it had singled out the USAP contract for termination because the company wanted to charge 70% more than competitors in Colorado and twice as much as competitors in Texas. And when the FTC raised concerns about their business practices, they sent anesthesiologist Peter Harkness, who was the chairman of the clinical governance board of USAP's Colorado branch at the time, to Washington, D.C. to lobby. But there's a twist. He's now suing the company. Harkness told the Washington Post, quote, "I was given talking points for the FTC meeting, but I'm a doctor, not a businessman. The USAP led us to believe what would happen is that we were going to be the premier practice in Denver. Patients and quality would be the first priority." And look, it didn't turn out that way. Harkness and other USAP physicians basically said that they couldn't provide quality care. And what the practices ended up doing is monopolizing markets and then using their large company leverage to negotiate higher payouts from private insurers, thus jacking up healthcare prices for all of us. Though their prices have risen, the company said hospitals and patients have saved money because USAP's patients spent fewer days in the hospital. But come on, let's keep it real. They spend a shorter amount of time getting the care they very likely need because these firms seek to increase patient turnover to increase profits. It's baked into their business model. So why are we allowing this kind of speculative behavior to be tied to our healthcare industry? And once you understand all the different players who are involved, all the different entities and corporations that make a ton of money, a killing off of this broken healthcare model, you get a better understanding as to why it's so difficult to even get something like a public option. You have to understand the system, the players who benefit from it, and come up with an actual strategy to get us to where we need to be for a better healthcare system. In the meantime, if these private equity firms continue to have these cozy relationships with our elected lawmakers, I mean, Biden is very friendly with the head of BlackRock, for instance. I mean, all of these issues end up leading to deregulation or less government oversight. I don't know why the FTC decided to allow these acquisitions to take place, especially since Lina Khan has been far more effective and aggressive in, pursuing antitrust cases. But we do see what the impact is, and people are not gonna be able to get the care they need, and they're gonna pay a lot more for that crappy care as long as we allow speculators to have this kind of control and impact on our healthcare system.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.